Alginate is basically a irreversible hydrocolloid elastic impression material which is used for recording the impressions of dentulous as well as edentulous, maxillary and the mandibular arches. So it is available in the form of a powder which is distributed either in the form of a sachet or in a plastic tumbler, from where it is taken in the form of scoops or directly dispensed from the sachets.
This video demonstrates the mixing of alginate. The four important components are a clean rubber mixing bowl, a pre-measured measuring cylinder, a plastic spatula, and a scoop for taking the powder. So starting with the mix, first we take 3 scoops of powder that is measured and incorporate it into the water, whether it is for maxilla. Coming to the mandible, 2.5 scoops is enough for taking the impressions. After this, the next step comes is once the particles of the powder are dispensed in the water, the figure of motion is started. So initially the slow mixing is done for incorporating all the powder particles. Next comes the vigorous motion or the aggressive figure of 8 motion, pressing all the particles to the sides of the bowl to incorporate or to express all the air bubbles. Once the mixture is smooth and creamy, it is ready for loading into the tray and taking the impression, whether it is maxillary or mandibular. Now we are showing the loading of the tray in the maxillary impression, and next will be preparation of the patient. The patient has to be sat upright and an ointment has to be applied around the corners of the mouth to prevent burning. So the tray has to be loaded into the patient's mouth starting from back to the front. The labial and the buccal tissues should be moved around to record all the vestibular areas. The patient should be asked to look a bit down, head downwards, to prevent gagging sensation. Once the glossiness of the impressions has been gone and we can feel it with our fingers, we can slightly run our index fingers along the vestibule areas to relieve the impression. Then with a motion, we can slowly remove the impression from the patient's mouth and check for any irregularities, all the areas recorded, whether it is recorded properly or not. Similar goes for the mandibular impressions. The main aim of this impression is to get a final cast, which is also very important for the entire diagnostic process of making a dental prosthesis finally.